My mom died of cancer and it tore me apart. Hi, welcome to my YouTube channel. My name is Brian and this is the Ivy Cancer Podcast. The death of my mom had inspired me to interview people with cancer or who have been affected to help spread awareness. The broader my subscribers are, the more people will be motivated to share their story. So if you come across this platform and you would like to help me achieve this goal, please hit the subscribe button. It will be greatly appreciated. A video will be uploaded every Wednesday. Thank you. So I want you to introduce yourself to the audience and tell us your name and why you choose the career path that you choose.
Alright, I'm Kayon Brooks Robinson. I'm a nutritionist here in Jamaica and I studied at the University of Technology Jamaica. Let me tell you, this career path was not something, a lot of persons, they might think that, from a very tender age, they want to be a doctor or a lawyer. I always knew that I love sciences. I know that there's no other thing that I'll do outside of the science, but I did not know exactly what I wanted to do. But when I was in sixth form, I think it was lower sixth, in biology, my sixth form teacher, Mr. Stedman, I can't forget that class. He mentioned something, I was doing a particular topic and he was mentioning that 90% of diseases have some form of link to your diet. And to be honest, from that day when he mentioned 90% of disease have that link to your diet, I went into the computer lab at 6 hour by stats and I type in science and food and I saw the word dietitian come up, dietetics come up. And from that day, to be honest, there is nothing else I have on my mind that I want to do outside of this. It just sparks something within me that I can't even explain. But a lot of persons have a backup plan. Say, if I don't be a lawyer, I want to be a judge or I want to be a police. When I was doing the interview to get into the program over by the University of Technology, I tell the man, say, listen, because you were saying if you don't get through with this, if you want to do nursing. I said, to be honest, might as well I don't come to university, because if I don't do this, there is nothing else that I want to do. That's how much I love my job. I don't see it as a job. I don't see it as a burden. It is something that I genuinely love to do. I love to shed light. I love to enlighten. I love the whole idea of preventative medicine. I love to see people get better. I just love the whole nutrition combined with science. I love science and I love to see people get better. I don't think or I don't believe that just managing the symptoms is the way to go. If I can prevent something from happening, that is exactly what I want to put my life. And that's exactly what I want to do. So nutrition is it for me.
Okay, so earlier on you stated that your teacher at that time said that 90% of sickness caused through your diet.
Right.
So are you? What did that mean to you?
Because at the time, to be honest, before he mentioned anything about nutrition or food, it was not something that I was thinking about. But yeah, no, I remember. We were on the topic of disease. And from the moment he mentioned that, then I started to think about all the different diseases that is out there. Even if it is not something diet related cause it has some form of link in terms of management of how you're eating. And I strongly believe, based on my practices now, that almost every disease that we have out there have some form of connection to the pattern, to the way, to the type of foods that we eat. So yes, I agree with this statement that 90% of disease have some form of link, not necessarily cause, but have some form of link to how we eat. I agree with that statement.
So are you saying then we have to be careful of how we eat and what we eat?
Right, we have to be very careful of how we eat. We can't just eat anything. Food is not food. I remember once I went to a medical facility for my child and I was asking the doctor about, because he was on some form of antibiotics, and I know the whole thing with antibiotics and food, and I was asking, is it that he's supposed to abstain from a particular type of food? Bear in mind, I have the knowledge, but I'm still asking.
Mm-hmm.
Is it that he should stay away from certain type of food because he's on antibiotics? The person looked at me and told me that food is food, and that really and truly sparked something in my mind. Say, even if you are a medical professional, it can be a radiologist, a doctor, etc. It's not everybody have the knowledge about nutrition. You can't really beat them down for that because that's not their training. Right. So everybody have different scope of practice. That is why I can't blame patients when they come to me and say, oh, the doctor never tell me, say, this can cause that to happen. That's not saying that they don't have basic nutrition knowledge, But all I'm saying, the dietitian is there for a purpose. You have certain diseases that have direct link to your diet, and if you don't see a dietitian, there are certain things you're not going to know until you see one. Let's just put it like that.
So basically, a dietitian and a doctor should work hand in hand then?
They should, because the management of any patient at all cannot solely be medicine. Because let me give you a good example. If a patient is presented to me or to a medical facility, then to a doctor, just an example, and they have high cholesterol, bear in mind, you have medicine out there for high cholesterol, but that is not what causes it. So if it is a case where they're eating a lot of high saturated fat foods and they're taking the medication at the same time, you know what they're going to say? Basically, they have to live on medication the whole life because they're not taking care of what is actually causing. If the causative agent is not removed, no matter what they do, no matter how much medication they are on, it's still going to be high until you have other problems going to come at the surface. So you have to work on it to get rid or manage the problem.
Alright, so let me get an understanding. So basically, you're saying that if somebody have a high cholesterol problem, it is caused by saturated fat. And if that person is still eating that saturated fat, taking the medication, it will only lead to something other else, because the saturated fat, the situation that caused the cholesterol at that level is high, it won't change anything because it won't change. You're still eating the saturated fat.
The problem is still there. The problem is still there. The medication lower it today, it manage it today, tomorrow eat the same thing. The problem is there. So you know what the solution is always going to be? You have to continue increase the dosage of that medication.
Okay, so can you give me a list of, if even 5 stuff that cause, some of the list, the food chain of saturated fats?
What, some of the foods, saturated fat or foods that
the food
for cholesterol?
The food that have saturated fats in them, or should I say that cause?
Okay.
Yeah.
No problem. So any animal type of food, for example, if you have well marbled meat, so you like your mutton, your beef, or you see the fat on it, those are high in saturated fat. If you like ice cream, because it is used with whole milk, the milk will come from the cow, with all the fat in it, the fat that the cow milk, it comes from the animal, then that is high in saturated fat. If you like things such as full cream yogurts, if it is whole milk that make it, it is high in saturated fat. If you like organ meats like kidney and liver, things like that, those are high in saturated fat. So anything that comes from the animal is high in saturated fat. And you do have other things that is high in saturated fat that don't come from animals as well. So for example, the coconut milk or the coconut oil. And please don't get me wrong with this, because a lot of persons say this is a very controversial topic, because you say coconut oil healthy, you say it good, but you still tell patients not to eat it. If you have high cholesterol, I will not tell you to consume things that is high in coconut milk or coconut oil, because it's high in saturated fat. If you don't have that issue, then fine, it's a very healthy choice.
Okay.
So context plays a role.
Okay. Okay. I'm glad they clarified that.
Thing is to read your food labels to look at what is high in saturated fat. You're not going to know just by looking.
Okay. I'm going to get to that in a minute.
Right.
But can you tell us some of the sickness that you treat?
All right. Hypercholesterolemia, which is the whole high cholesterol thing. Hypertension, all type of diabetes. I specialize in diabetes because I'm a diabetes educator as well. So diabetes type 1, type 2, gestational diabetes, PCOS, you have end-stage renal failure, irritable bowel disease, ulcerative colitis. Those are some of the main conditions that I manage on a daily basis.
Okay. What really causes diabetes on your understanding?
All right. So if we should say what really causes diabetes, all right, let me just go on type 1 diabetes. Most of the time it is genetic, and by having type 1 diabetes, you're not going to know that until, let's say, you're young. So a person that is your age then, or my age, wouldn't just know that they have type 1 diabetes. You'd have to know from a very young age. And that is basically the absence of insulin. That is what causes it. The hormone insulin that's responsible for when you eat food, it map it up from your blood and bring it where it's supposed to go. You don't have none at all. So that is why you have to be on the injection for life. With type 2, and this is the type of diabetes in which they will tell you that, them cure diabetes. If you want to talk about diabetes can cure, it will more be type 2 than type 1. Because type 1, there's no cure. So for type 2, you do have the insulin there, which is the hormone that is responsible for, the blood sugar, doing what the blood sugar is supposed to do. That hormone, it is there, but because of the excess weight, your body is not sensitive to the hormone. So all of the sugar that you're eating from the food, it is in your bloodstream. So a lot of patients might find it that with lifestyle changes, eating healthy, exercise, the body becomes sensitive again to insulin, and they will say they cure diabetes. Okay. That is where the word curing comes in. But for some patients with type 2, that's not always the case. Because yes, they might have the hormone insulin, but because they have type 2 for such a long time, some of the cells that secrete that hormone is damaged. So for them, there is no cure because they cannot replace back those cells that secrete the hormone. So they have very little being secreted into the blood. So it's not a case where they don't have it at all in the case of type 1, but it's a case where it is damaged. Okay. And if I should say what is the cause, no, it's not sugar cause if I have diabetes, contrary to popular belief. It's not sugar. For type 2, it is more a disease of fat than a disease of sugar. Because if you have excessive weight, the body is not sensitive to insulin. If you do have the diabetes, if you do have the disease though, it affects blood sugar, but that's not what causes it.
Okay. All right.
Right.
Somebody in the comment section is asking if you have PCOS. What food you should avoid? Could you give us some knowledge on that?
All right, sure. So for patients with PCOS, there's a lot of things going on with them. And in a lot of cases, if it is not managed, you're going to become type 2 diabetic.
Wait, one second. So are you saying PCOS linked with diabetes?
Right, it's a hormonal issue.
Okay.
And in the case of PCOS, you have a thing where they call trying to prevent inflammation in the body. So any food that causes inflammation in the body, we normally tell patients to avoid these things. So for example, something as simple, we might not know, something as simple as using vegetable oil to cook is classified as highly processed oil. So every single time you're using that oil, it's causing inflammation in the body, and it is making the PCOS symptoms worse. So in the case of PCOS, one of the hormones that we try to reduce or to manage is our cortisol hormone, which is our stress hormone. So something as simple as going past your bedtime, your body views it as stress. Something as simple as exercising for too long, your body view it as a stress. And once your body view it as a stress, it is going to secrete the stress hormone cortisol that will increase your blood sugar. And that is why most of them eventually becomes diabetic. Because that hormone increases blood sugar.
Okay. So basically you mentioned something about cooking oil. For me, I use extra virgin olive oil. Is that something that you would recommend for somebody have that PCOS?
Alright. So let me put this out there though. For you're a guy and guys cannot get PCOS.
No.
No, I don't. She said I use it.
Yeah. Okay. I'm glad you clarified that.
Right. Only females get PCOS.
Right.
Polycystic ovarian syndrome.
Okay.
It's not something that can ever go away, but it can be managed. And it can be managed in such a way that you eventually have children, you live a normal life, you don't become diabetic. But the treatment nutritionally is very, very strict in terms of eating on time, trying to avoid highly processed food. I place almost all of my patients that have PCOS on a dietary prescription, so they know how many calories they should be eating, what foods to eat, what time they should be eating. It's very strict, and a lot of them give up. I'm telling you the truth. A lot of them give up, and it eventually results in diabetes. It is sad, but it's just the reality of the condition.
Yeah, people, when it comes to health and discipline, I realize it's not everybody has that in them.
No.
They rather to just know, say, what you know. Some people that say, you know, I can't manage, I just continue with my food because I can't eat this, I can't eat that. So I realize that when it comes to some people health and discipline, they don't really have that much discipline. So like, what are the percentage rate of the patients, of the healing process of your patients?
Alright, so let me tell you my honest opinion based on all the patients that I've seen. And I did not mention it, but I'm in this nutrition business, I've been practicing for over 5 years.
Mm-hmm.
And 90% of the patients that come through my hand, they have good results. 90%. And I say that without fear of contradiction or anything. 90% of them have very good results. And this is one of the reasons why. If a patient comes to a nutritionist or a dietitian, whichever, if you go to a nutritionist, you don't expect to be given a list of foods to eat or foods to avoid. Because chances are half the food on that list you don't eat anyways. So you're still leaving that office confused. What to eat then? Since I can't eat this and I can't eat that. So how is it that I'm supposed to prepare it? Alright, I give you a list of foods and you work with the list to eat, but you're going to hear that I should manage my portion. Mm-hmm. No, I ensure that, and that is why I give every patient an individualized meal plan that is based on my assessment. So when you come into a session, I have to know what type of work you do, what you're doing at work, what exactly is your activity level, what time you reach home, do you have time to cook your food, what type of food do you have access to, what is the type of things that you like to eat, what is it that you don't like to eat, whenever you're menstruating, what is the type of food you crave, when exactly do you exercise, what time you exercise, because all these small details plays a role in the time you eat, the type of food you eat, and how much of it you eat. So for example, I normally tell my patients that are diabetic that nothing is wrong if you eat cake. But tell me exactly when you like to eat the cake so I can know how much of it I can tell you to have. Nothing is wrong if you like to drink soda occasionally. I would never tell you say you can't ever drink those things because I'm the one that will calculate how much you can drink to fit it into your calorie for the day. You understand? What time of day exercise? Because that plays a role in what time I'm going to give you certain things to eat versus certain things to drink. So you'll know exactly what to do for you specifically. And that means that somebody else with that same condition might take up your meal plan and it makes for them condition worse.
Okay.
Right. So everything is specific, and that is why I get such a high success rate, because it is so specific that you know exactly what to do. You don't leave the office feeling confused and wondering when I gonna eat, then how much I gonna eat. Everything is all planned out for you specifically.
Okay. Somebody in the comment section was asking what's the best aisle to use pertaining to the PCOS.
All right. So I should have mentioned it initially, I'm not one of those nutritionists that randomly give nutrition advice if I don't do an assessment. And let me tell you why. Because I might tell you that the best oil to use is coconut oil then. Let's say I tell you coconut oil, and you go home and use coconut oil. I did not know that your cholesterol was high. And when you look at use the cholesterol, because the nutritionist tell you say cholesterol, coconut oil is good, you're using it up and it make your condition worse. So I prefer to give certain advice when I do a thorough assessment to know exactly who I'm giving certain things to. So if you don't have no medical condition, you're completely healthy, fine, you can use a coconut oil, you can use the extra virgin olive oil or your olive oil, you can use your avocado oil. Occasionally, you don't have any condition, you can use a vegetable oil. But it all depends on who I'm talking to. You understand?
Mm-hmm.
And that is why I don't just give one advice and say, you have diabetes, then eat plenty of things that is high in fiber. No. Or people come and say, you know, so my pressure high, what kind of rice I can buy? I don't just give advice like that. I prefer to do an assessment, then I can advise you based on everything that I gather.
Okay.
Right.
All right. What is gut health and how is it impact us?
Repeat, I can hardly hear you.
What is gut health and how can it impact us?
All right. So your gut basically is your whole digestive tract. You hear me?
Yeah, man, I'm hearing you.
Yeah. Your whole digestive tract. So starting from your mouth to your anus, the whole tract is basically your digestive system, right? You see that stomach of yours that you have, there's certain microorganisms that lives there. We call them residential microorganisms. Them live there, and they're there to benefit your body. There's a number of things that you can do to decrease that population, and there's a number of things that you can also do to increase that population. One of the benefits of those microorganisms is to strengthen your immune system, they help with digestion of your foods. It helps you to basically prevent a lot of these diseases that is out there. For a lot of persons with diabetes and all of that, trust me, their gut health is very poor. And one of the reasons is because they don't feed or take care of those microorganisms that is in their digestive tract. So for example, if you have sinus problem and you're always on things like antibiotics, yes, it is killing out the bad bacteria, but in the process, it's also killing the good ones. So I normally tell people that are on those medications, put them back. If you're going to take antibiotics or certain medication, try your best to put back those microorganisms that you destroyed with the medication. Certain foods that are highly processed kill those. Certain foods that are highly processed kill those microorganisms as well. So there's a lot of things that contribute to your gut becoming faulty. And when a lot of when you have patient that has gut disease like Crohn's disease, irritable bowel syndrome, most of the time they have leaky gut.
Mm-hmm.
And by leaky gut, I mean, think of your digestive system as a cheesecloth, right? The purpose of that cheesecloth is to put the nutrients and the water from the food that you're eating into your bloodstream. So once it is into your bloodstream, that's where you get the nourishment and all of that. But you see the person with all of those disease and with a leaky gut, that cheesecloth is very big. So it's more than nutrients and water coming out into their bloodstream, because the holes in that cheesecloth, it is too big. So that is the digestive system. It's like a cheesecloth. It squeezes out the nutrients and everything from the food. But when you have a leaky gut, the holes in the cheesecloth too big. So you find it that you have toxins that leave from your digestive tract to your bloodstream, and that is how you get a lot of the condition. Like sometimes you get the diabetes and all of the gastrointestinal diseases because you're not taking care of that gut. So one of the things I always tell my patient that you're supposed to be getting your probiotics, which is putting back the good bacteria every single day. One good source of it is your yogurt.
What kind of yogurt?
Mm?
Is it all yogurt or special kind of yogurt?
Yeah, alright. For a lot of person, because if you're a healthy, regular person, no diabetes, anything like that, you can just buy, well, once it marked probiotics, because it's not everything that is marketed as yogurt is actually yogurt. I did a video the other day on that. If it marked probiotic and it says yogurt and it's on the fridge, then it's a yogurt. So you can buy flavored yogurt, no problem. I don't have a problem with that.
So you're saying then, if we're looking out for yogurt, look for the one that stayed probiotic.
Right.
And that will help.
A lot of them, they're milk products. They're not yogurts. But it's marketed like yogurt. I don't want to call the name of any brand right here.
Yeah.
But a lot of them, it's marketed like yogurt. And it might use a name similar to yogurt. But if you really look at it, it don't say probiotic and it don't say yogurt. So you can't really sue the company for deception.
Right.
Because they did not actually tell you that it's a yogurt. And it might even taste similar to a yogurt. And that is why it is important to read things before you consume it. Because you can't say, me never know, so why them never tell me? Remember that the food industry is to make things taste nice and to get people to buy the product.
Okay, so now that you mentioned about reading the labels, how can we understand a label and the benefit, if it's good for us or it's bad for us?
Alright, the first thing is to know your condition. If you know you have high blood pressure, know what you're looking for on the label. And this is why it is important to have at least once in a life, or maybe once a month or once a year, to consult the nutritionist. Make them know what is going on with you. Because this minute you're healthy, the next minute you go doctor, they tell you that your blood pressure is elevated. And you want to know how and what to look for on a food label. You have a lot of things that is on the food label. A lot of things. If you have end-stage renal failure, then you're looking at the potassium content of a particular food. Because your kidney is what balance the sodium and potassium. If you have high blood pressure, then you're looking at how much sodium, how much salt is in a product. Then you'll know that if you consult the nutritionist, anything that is more than 400 milligrams of sodium, that is too high per serving. That's too high. So when you see one tin sausage having 910 milligrams of salt, you know that's not for you.
Yeah.
So it's important to know your condition, know what you're looking for. If you're a diabetic person and you're supposed to know how many grams of carbohydrate is in a particular product, and your dietitian say, well, during snack time, you're not supposed to have more than 15 grams of sugar. So if you take up a slice of bread and you look at the food label and it says one slice have 27 grams, then you know so you only can eat half of that bread. Okay. So you have to be reading the food label to know what you're looking for. Everybody is reading different things. I'm not saying that if you're healthy and are supposed to read, you still need to know how much serving is in a container and how much of that serving you want to consume. But if you have certain conditions, it is important to know what exactly on that label might make that condition worse and what on that label might make it better. If you're the type of person that is looking for foods that are highly processed, then the dietitian will teach you that any product that you see more than 5 additives or preservatives in it, then it's classified as highly processed. You know, they will teach you what to look for.
So, like, on some of the bottled waters, I see more than 5 ingredients in it. So you're saying avoid those kind of waters?
No, don't get me wrong. Mm-hmm. I did not say more than 5 ingredients. I said more than 5 additives and preservatives.
Well, additive, yeah, basically. Yeah.
So it can be that, let's say you have a tin mackerel, or you have a product, and what they put in it is olive oil, they put coconut oil, and they put what else? Just something, peanut butter.
Mm-hmm.
Those are natural products.
Right.
So even though it might be more than 5, those are things that are natural. But you see some long names in which you cannot even identify.
Yeah.
You don't even know what the name means.
Yeah.
Once you see more than 5 of them, you know that products they are highly processed.
Yes.
So that is how you identify when a product is highly processed, because everything is processed. Once you pick a yam, or you pluck up some yam, or take it off of the tree, and you cook it, it is processed. So you can't tell people, say, you know, you're not supposed to eat processed food. We all eat processed food. It is impossible not to eat processed food. Once you cook a food, it is processed.
Suppose me tell you, say, I thought that processed food, it was, you know, the packed food them with them having in the fridge, where you just put in the microwave, and I just think that is just processed food. So you are enlightening me now. So even when we go in my kitchen and I cook my chicken, I process it. You
process it, and by processing it's still destroying nutrients. So if they want to say processed foods is not good, you can't say processed food is not good. Because once they change the natural state of the food, it is processed. If you put a coconut water in a bottle, the fact that is not how it comes, you're processing it. Okay. If you transform a sweet potato into a potato pie, it's processed food, because that's not how you get it. So it's impossible to eat food in its natural state all the time. The key thing is to try to eat foods that are not highly processed, with not a lot of preservatives or additives. So there's a difference. If you put food in a microwave, it could be that it's pre-prepared. That doesn't mean that it is highly processed.
Okay. Well,
you're going to know by reading the food label if it is highly processed.
Okay. So some of the packed food them can be low, less processed. Okay.
Some of them, the only thing that they do to some of the food is dehydrate them, meaning they remove the water from it, so it comes in a powdered form. Mm-hmm. So it is easy. I'm not saying that's the case for all products that are in package, but some products, all they do to it is dehydrate it. That means they remove the water, so it have a long shelf life. It's not everybody add additives or preservatives, and I think it is wrong of people to try to assume, and that is why you can jump with knowledge or common sayings that people have, you know, without properly being informed of things.
Okay. I heard you mention twice, I think, about renal failure. Is it both sex can get renal failure, and what it is?
Alright, end-stage renal failure. Alright, so you have different stages to your kidney failing. Different things can cause your kidney to fail. If you are diabetic and you're on medication for a number of years, most of the time you end up with renal failure.
Alright.
If you're hypertensive and it is not managed, you end up with renal failure. Not saying it is a must, but they are basically a precursor to getting end-stage renal failure.
So renal failure is your kidney
failing.
Okay.
Yes. Okay. And most of the time you don't know that your kidney is failing until you reach the last stage. It's very, very hard to catch it, let's say at stage 1 or stage 2. Because you have 2 kidneys, when one fails, you're not going to know until the other one fails. And when the other one fails, then that is when you know it reached too late. So most persons find out when they reach stage 5 or stage 6 dialysis stage. And let me tell you this, when your kidney fails, if you don't know anything about restriction when it comes on to diet, just one single slip up, and you're gone in weight file 13, you kick the bucket. That is how serious that disease is. And your kidney do a lot of things. When you talk about fluid restriction, you can't drink more than a particular amount of water. If you drink particular amount, you see you come in swell up. If you eat more potassium than you need to, you start seeing certain things show up in your body. I was working at Spanish Town Hospital, and I remember a lady, she came in and she was normal before the disease, and her bones just started to push out. It affects literally every single part of your body. Think about some normal foods that you like to eat. Things like ripe banana, coconut water. You like to eat a lot of meat. You like to eat a lot of ground provision. You cannot eat those things. You can't eat peas and beans. Regular rice and peas, we love as Jamaican. You cannot eat those things.
Somebody said tomatoes as well.
For what?
When you have renal failure.
No, tomatoes can be eaten. Nothing is wrong with tomato. They're low in potassium.
Okay.
So the two things, well, your kidneys manage a lot of things, but the two things that your kidney manage is sodium and potassium. Because the more you eat things that are high in sodium and potassium, is the more work you're giving your kidney. Remember that the function of your kidney diminishes with renal failure. So you're trying not to put too much stress or strain on your kidney. So anything that will put a strain on it, you avoid it. And most of the foods that are high in fiber, like the whole wheat this and the whole wheat that, they're high in potassium. So you find it's a patient that has kidney disease and diabetes at the same time. They might be, if they don't see a dietitian, they might be confused because they're saying that, oh, them say wheat bread and all of them something good, and now me hear so me can't eat it.
Well,
because yes, it managing your blood sugar, but it's making the kidney worse. That's why you have to see a dietitian.
I think there's a controversial in my mind pertaining to oats. Because
pertaining to what?
Oats.
As it relates to the disease?
No, but if it's good or bad, because I grew up knowing that, you know, oats is something that's good, but there's some videos circulate and I come across, oh, oats is not good for your gut health, oats is not this, oats is not good. So, as a nutritionist, what are your take on oats?
Alright, so for oatmeal, and this is where the gut health comes in. Remember I was telling you that there are certain microorganisms that lives in your digestive tract, and eating yogurt put those microorganisms there like back. So you have good bacteria, that's what you get from yogurt. In order for those bacteria to survive, they need foods that are high in fiber. You ever hear the word prebiotics?
Yeah.
Right, so the prebiotics is what feeds the probiotics, which is the microorganism. And oats is very high in fiber, so it helps to feed those microorganisms. So yes, in that case, it's good for gut health.
Okay.
And I always tell people, please be careful of where you're getting your nutrition advice from. A lot of persons, anybody can put out videos, right? A lot of persons can just hear something and put out videos. They can be so convincing. Celebrities, they are very convincing, especially if they look like, things that work for them.
Right.
And people run with it and take it as gospel. But it's important to get your information from credible source, because a lot of persons hear certain things and they put out videos and no, this no good. But in what context are they talking? Is it that it don't good overall? Who is it not good for? Because you do have persons that cannot get high fiber foods. So if that is the case, then fine, I'll agree. It's high in fiber, helps to feed those microorganisms, and that is good for your gut.
Okay.
So that's my stance on that.
Okay. Thyroids. Can you enlighten us about thyroids?
Alright, so your thyroid gland produces a hormone that we call thyroxine, right? And for a lot of persons, they don't even do hormone testing, so they don't know if they have something that we call hypothyroidism or hypothyroidism. So I'm not picking on you, I'm just using you as an example because I know you. So let's say you're a person that you can't gain weight no matter what you eat, right? For a lot of persons, their weight can be due to the fact that they have a hyperthyroidism, and the purpose of your thyroid hormone is to build up or break down food. So if your body is producing more hormone that helps to break down food, then you're going to find it that no matter how much food you eat, you always lose weight. While you have some person, them have problem to lose weight no matter what they're, and then they don't know, they don't do a blood test, and the doctor or whoever it is might say, eat a type of food here, eat a type of, but I would recommend, and this is why most persons that come to me, I always tell them, please go and get a blood test done so I can know what is going on with you. Because your weight might be due to PCOS, your weight might be due to this. If you have a thyroid hormone that is inactive, that means that your body is breaking down food very slow. So too much is bad and too little is bad. So it's important to know by doing a blood test. And then we can know how to treat it after.
So the only way you can find out if you have thyroids is through a blood test.
Right, and by thyroid I'm saying an overactive or underactive thyroid. It produces too little or too much hormone.
Okay.
The only way you can know is if you really do a blood test. So somebody cannot look for you and say, you look slim, you have thyroid problem. No.
You can gain weight.
And there's somebody that mentioned something in the comments. Can I answer it?
Yes, sure, go ahead.
They said here in Canada they avoid it, and by it I'm thinking they avoid what? Tomato? And by it I'm thinking, alright. So different regions avoid different things or classify things differently. Right? When it comes on to different foods. And let me give you a good example. In Jamaica, here, we classify foods based on their nutrient content. I know that in America, they classify foods most of the time according to biology. So a person might be eating a potato, and in their mind, they are saying that they're eating vegetable. Because technically, in biology, potato is a vegetable. But we don't classify foods like that here in Jamaica.
We classify potato in Jamaica as food.
We classify it as a starch.
Ground
so
provision.
If you're eating a lot of potato, we're going to say you're eating, it comes from the starch group.
Right.
So you're not going to see somebody eating fries and we tell us that they're eating up their vegetables. So different countries classify things differently, and how they classify things can really impact how they manage diseases. So I don't know why in Canada they would eat tomato, when they would avoid tomato if they have end-stage renal failure, but in Jamaica we try to make our patients avoid certain things as it pertains to renal failure if they're high in potassium or sodium. Tomato is a low potassium vegetable. So in that regard, we tell you that yes, that is one of the vegetables that you can eat if you have renal failure. I don't know if there's a other reason why Canada tell you to avoid that. But we allow you to have that here in Jamaica based on the potassium content.
So, like, what are some of the symptoms, signs that you may see if you're having thyroids that would lead you to go and do a blood test or do a checkup, apart from the weight loss?
Mm-hmm.
What are some of the signs that you will see if you're having thyroid's issue, apart from going to do a blood test?
Alright, so you would realize that lack of energy, no matter what you do, you just always feel tired. Some person, they realize they always have this anxiety issue, they always have this nervous thing, and for some patients, they will realize rapid heart rate. And while some persons, they're asymptomatic, they don't realize anything than the fact that no matter how much food they eat, they just cannot gain weight. While on the other hand, some persons realize that no matter what, they just cannot lose weight. So it is very hard to pick out and say you have thyroid. You're not going to see a bump right here and say, so thyroid you have, or you're not going to feel sick. No, you don't really see those things. Most of the time is the weight issue make you really go do a blood test.
Okay.
And that is why everybody must get blood tests done. So you cannot tell sometimes with certain illness what is going on. You cannot tell.
Here in the UK, they give you a regular check. So, like probably every 6 months or to a year, they would call you in and say, "Oh, you're due to do your tests, your blood tests, so come in, etc., etc." I think if every country had that, especially in Jamaica where I am from, that would have helped eliminate a lot of sickness.
As in they call you in to do your blood test?
Yeah.
If you're working?
working
or
at,
anybody at all.
well, once you join the NHS doctor system here, they call you into, you know, come and do your checkup. So they do a yearly checkup or a 6 months checkup depending on your situation, your condition. So whether you're healthy or not, they call you and said you're due to do your checkup. You know, like when I just came into the country and they phoned me and said I should come in to do a checkup. I was wondering what checkup I need to do. You know, however, when I went in and I do my checkup, I realized, you know, they check the function of your liver, they check your testosterone, they check your, you know, these things.
Yeah. Okay. We are here in Jamaica, I'm telling you the truth. It's getting better because I realize a lot of different workplaces, they send them to do an executive test.
Right.
Which they have to do one every year. And that's when a lot of persons realize a lot of things about them. In the past, I never used to hear that, and I realized I'm hearing that now. So I guess it is getting better here, but as I said, if you're not working, nobody now will just randomly call. I don't think the government or the ministry is going to call and tell us, you know, you do for your blood test. No, we don't have that. You have to be working, and the workplace telling us you need to do an executive test every year. Yes.
Oh, thanks for coming
That's
in.
why I asked if you have to be working.
Okay. All right. Testosterone is a big thing that affects men, and I get to realize that testosterone is something like a male menopause. Could you elaborate on some of these effects that testosterone can cause in men?
Alright, so testosterone is a male hormone. It's a male sex hormone. So you see that deep voice that you have, the Adam's apple, all of those things, the facial hair, the chest hair, your testosterone is responsible for that. So every male should have a certain amount of testosterone in their body. When they say sometimes they start to act feminine and all of that, and they start, you know, they curl their hands, etc. Sometimes they have less than they should. What testosterone is what give it that manly thing about you. It's the testosterone that you. So everybody have testosterone. Once you're a male, you have testosterone. You have that hormone.
You mentioned that it should supposed to be at a certain level. When you said it's supposed to be at a certain level, what do you mean? All
right. So just like when they say go to the doctor and they test what is your test, if your testosterone is all right. For every single thing, there is a range in which things supposed to be at. Once it is not where it's supposed to be at, then it can cause problems.
Okay.
So I don't know the exact figure in my head right now, but for every single thing, every hormone, there's a range that should be in your body. Even females, there's a range of female hormones that we're supposed to have. When you're pregnant, you're supposed to have a particular hormone in your body. So yes, once you're a male, you have testosterone. The issue comes in, and this I really want everybody to listen to this. The issue comes in when you have a lot of medical condition. And let me give you several examples. The cholesterol in your body, the cholesterol that your body makes, and this is why cholesterol is not something that you need in your diet. Your body naturally makes cholesterol. So you don't need to eat it in food. That is why when you eat food that has cholesterol, it brings up your cholesterol level because your body naturally makes it. So the purpose of the cholesterol is to make your sex hormone. I have a lot of patients that come to me, right? So I have a special scale in my office. So when they go on my scale can tell me if their body fat is within normal range or it is higher than it should be.
Yeah, I have one of those scales.
Very good. But those values mean something. You see, if your body fat is lower than it should be, for a man, then I can tell you that in terms of the sex hormone, your body now produce the amount it's supposed to produce. So if you have problem with your sex drive, not even sex drive, having children, and all of those things, then we can tell you need some more body fat. Your body fat is too low. Because is the body fat responsible for making the sex hormone. So if you don't have enough body fat, your body is not making the right amount of sex hormone that it should be making.
So how do we calculate our body fat, our age, and our height to know how much body fat should we have?
And alright, so the body fat is something. One, it can be done through blood tests, and you have scales that do it. We know the range. So like for males, they are not supposed to have less than 8% body fat. No less than 8. So and that is not something that you can look at a man and tell, say, you know, say you, because you look slim, your body fat is little. You know why? Because a lot of athletes that you see out there, they are very bulky, but most of that weight is muscle.
I was just about to say that.
Most of their body fat.
I was just about to say that because being a part of the gym family, I've realized that the men try to achieve a certain body, a physiques, and certain men try to put their body fat below 8 or 10 or whatever.
And that's not healthy.
So and a lot of them, especially the body lifters, the body weight builders, even though they look bulky, but some of them, the body fat is very low, and some of them come up with cardiac arrest and stuff like that. So you're saying that these things affect your testosterone level?
Right, because as I said before, your body fat is what makes your sex hormone. If your body don't have sufficient fat, it is not able to make it. And on the flip side, that's man we're talking about. You see, for females, you see a lot of them that are underweight or their body fat is very low. You find it that they can't have children, and that is why a lot of athletes, in order to start have children, a lot of them have to stop.
Okay.
They look back, yes. So if they try and have it naturally, you know, them are practice same way, you realize that they have difficulty having children because them work out all of them body fat. Them not making a sex hormone, and that is why you find it that a lot of them don't menstruate.
Oh.
Because that is one of the things that your hormone does. It helps you to menstruate and all of those things that would enable you to have a child. And look at models. Most of them, they don't have sufficient body fat, and that is why they don't menstruate and they have difficulty having children. It's the same thing for men. They work out all of the body fat, or it is just not sufficient, and that is why it's good to get your checkup. It's not sufficient and they can't have children, and then blame the woman. And that is just the body fat aspect. I have patients that come in and, you know, man and woman trying to have children, and as usual they think it's the female fault. And you know the culture in Jamaica already. You know, them are masha works, them steam fish and okra mentality. And okra is something that prevents and lower the testosterone levels in the body for men.
Stop.
Right.
Stop. So
yeah.
So hold on there. I am one of those persons. I love my steamed fish and my okra. I love my conch and my okra. So you're saying too much okra lower your testosterone?
I am saying that if you plan, say today you and your girlfriend or your wife are going to make a baby,
don't eat no
and you
okra.
want to eat up your steamed fish and okra, that's not a good option.
Oh.
Because the production that time, if you have your high sperm count and you really be effective with making a baby, it will go prevent all of that with the seeds, because there's a chemical in the okra seed that prevents or make that process very hard.
Okay. So men,
don't get me wrong, the okra is bad.
Men, listen. If we're not going to mash at work and not feel like say the okra and the steamed fish, I go build the stamina. It may build the stamina, but if you want a youth, avoid the okra.
Prevent it.
Okay.
Right.
We learned something
So
now.
you get the context.
So me remember when me did young, yeah? And me said to my girlfriend like, yo, listen, steamed fish, okra, and me have my Guinness. My Guinness punch and whatever, cause me are ready at the back, you know. Cause I say, yo, this I wanna must connect. So
Jesus.
when me do all of that, me never know say me I set up myself for feel.
To fail.
For feel.
Yeah. You're setting up yourself to fail.
So maybe that's why I never get the youth from an earlier stage then.
Trust me. And next thing is that when it comes on to men, as somebody in the commitment and erectile dysfunction,
Yeah.
if you have diabetes, and this is why I tell patients that everybody that comes through my hand, I prefer to do a thorough assessment where I assess dietary wise, and I assess your physical before I can tell you anything. I have patients that come to me, you know, the man a cheat because, you know, him now get an erection and all of that. Guys, if you're diabetic and your blood sugar no control, you're going to have erectile issues. And it's not because you don't have any feelings for the woman. High blood sugar causes neuropathy, which is nerve damage. High blood sugar blocks blood flow. High blood sugar will prevent the erection from happening. So if you know that your blood sugar is not controlled, or you find it, boy, lately, you know you try hard and no erection, then it might be that your blood sugar is too high. Nothing wrong with you, and it's not old, they're getting old. It's just that your blood sugar might be too high. Go and get your blood sugar tested. Go and know if your diabetes is controlled.
I'm due for one as well.
So diabetes can cause that problem.
I'm due to do a blood sugar test as well. So the testosterone.
The male hormone, yes.
Does it cause erectile dysfunction as well and low libido?
No man, because that's the hormone, you know.
Yeah.
It don't cause the erectile dysfunction. The erectile dysfunction comes in when there's something blocking the blood flow.
Okay.
So in order to get an erection, a blood will go right there. So.
Yeah, blood
So
pumping.
some patients or some person, if them anemic or them have a low blood count, they find it that it's very hard to get an erection. So you might check that out. Say you just meet in an accident, something will cause you to lose a lot of blood. And you realize that it's very hard to get an erection. Your blood count might be low.
Okay. So what are some of the things that we can do to build our body fat, to eliminate testosterone?
Well, you can't eliminate your hormone because
Not eliminate, to raise it, to make it higher, or at the level where it should be.
That you keep your body weight in the normal category, because as much as I mentioned to you that having a low body fat affects your testosterone level, having a high body fat does the same thing.
Okay.
So try your best to maintain a healthy weight. You can't get around that.
Well, my scale have all of those kind of information. It tell you your body fat. It tell you your skeleton bone. It give you protein. It tell you your protein. It give you all of those information on it, and it have an app as well. So you know whether your muscle is growing. I definitely buy that because I'm trying to do the gym thingy.
Okay, yeah, it's very good to know if your muscle is normal or to know if it is low. Because a lot of person working out and they're not losing 1 pound, just muscle, because they're not eating properly.
Yeah.
And muscle building is like 90% nutrition and 10% exercise.
Okay.
Right. So it's important to keep your weight in check for your testosterone to be at the normal level. It's important to eat healthy, proper diet, try to reduce your intake of processed foods, because guys, every time, even if you're not a sickness, processed foods cause you this word inflammation in the body. It makes your body work harder. When somewhere inflamed, it's extremely red. Everybody know that.
Okay.
When your organs or your body process, everything in your body is inflamed, then you know it's on its way to damaging and disease. So try your best to reduce your intake of highly processed food. eat a balanced diet, eat on time. So even if you eat a balanced diet, you not eat on time, you basically still a work against your body. Try to eat the correct portion for your activity level, because not everybody's supposed to reduce the amount when they eat.
Someone asked in the comment section, what is the symptoms of premenopause?
Alright, so if you're premenopausal, you're going to find it that for some persons, they sweat a lot. They're going to find it that them sweat a lot. They're going to find it that for some patient, I had a patient where them get a stroke. Your hormone is what protect you from, as ladies, your hormone is what protect you from getting a stroke. That is why females don't get stroke as much as men, because of your hormone level. You see that drop in hormone level, that is when females sometimes get a stroke. They not eat properly and the protection is gone. So you will find it that drop in hormone. Then you'll find it that your bones and your teeth easy to break and it's very brittle, because your hormone helps with the density of your bones as well. So you find it, so you get things like Easter malacia and all of those things that never used to occur. You realize your bones start hurting and all of that. For some patients, they just have this paranoid feeling. I got a lady in my office and she was very everything, she feel, and that is because the hormone level decrease. The hormone do a lot of things for you, guys. So that drop, it might not gone completely, but that drop or that decrease in hormones, you start feeling rapid heart rate, you start feeling nervous, anxious, anxiety, you start feel as if you're losing weight, and that is because your hormone levels drop. I cannot tell you that some of these can be prevented with diet, because once you're getting old, it's going to drop. But some of the things like the stroke and, the Easter malacia, those things that you can prevent with eating healthy, I would say before you reach menopausal age or you reach full menopause, try your best to maintain the integrity of your bones by eating healthy. Try your best to protect your heart, not eating a lot of foods with saturated fat, eating high fiber foods to get rid of some of the cholesterol from your body, to ensure that when your hormone protection gone, you're already strong enough so you don't forget the stroke or the heart attack.
All right. Somebody asks, how do you know? How do you know if a woman during menopause has a drop in their testosterone?
You cannot know those things unless you do a blood test, and that is where your endocrine factor. And that is why it is so important to do blood tests. I always tell my patients this. Anywhere you go, any medical professional, and then start treating without the proper blood test to get a good diagnosis, run. Because nobody can tell you anything until they see evidence that this is what is happening. So you cannot know those things. Yes, you might have sign and symptom, but you realize a lot of sign and symptom of things, they are very similar.
And it can mean many different things.
It can mean many things. So you cannot know directly until you do a blood test, a hormone test, and they say, oh, this is dropping, this is what is happening. Okay. So hormone tests, blood tests, and your blood can tell you every single thing.
Well, Kayon, I'm not sure if you guys have any other question that you would want to ask, because we're about to wrap up. But Kayon, I think we may have to do another part 2 to this, because it's very informative.
Yeah, very true. There's one thing I would like to add about one thing, and I know that a lot of person might want. There is an amino acid glutamine. There's an amino acid glutamine that some person asks me, if it is okay to take. Remember earlier when I was telling you that the fact that your body produces cholesterol, you don't need it in your diet? That is the same thing. Okay. Anything in which your body produces, it's viewed as non-essential. So yes, it is a protein, and proteins, they are very important for the body. But your body makes certain amounts of protein already. The ones in which your body don't make, you get them from your food. Glutamine is one of them in which your body produces. So if your body produces it, there is really no need to be taking it. So you'll find it that a lot of these protein powders, have these things. And I would say, without fear of contradiction, that they're a waste of money.
Okay. Somebody asked, what age menopause start and stop?
It varies for females. Some females reach early menopause because them start to some of them menstruate early, so they reach menopause early, while some reach it at 60, some reach it at 45. So there is no definite age to tell you that you're going to reach menopause. I know a family that reach menopause very early, like early 40s.
Okay.
So it varies. There is no definite age.
Someone
Some
asks,
females can still get pregnant at 60.
someone asks, how can we find you to do a checkup?
Alright, so I'm located, if you're in Jamaica, I'm in I work at Pomer Hospital Complex over and by Rima Medicals in Independence City. Pomer Hospital Complex is on the mall. Or you can do a virtual consultation. I do virtual consultation if you're not in Jamaica, or if you're in Jamaica but you're far or you cannot come in person. I do virtual consultation as well, and I also do home visits.
Okay. How could they?
My page and you see my number.
How could they reach you by virtual How could they reach you virtually if they want a virtual consultation?
Alright, so they can always send me a WhatsApp message or contact Optimal Body Nutrition 803-3302. That's my business contacts. And they can always set an appointment through that number. They can shoot me a message on my TikTok page. They can always shoot me a message and I will give them that number as well if they did not get it here. Or they can just send me an email at optimolbodynutritionja@gmail.com.
Are you on IG? Because some people is not
right. Same Optimal Body Nutrition JA.
Okay. Well, Kayon, thank you for passing through. As I said, we might have to do a follow-up because time, but we really do appreciate you coming through. And we learned a lot, and I appreciate that so much because some things I never know. I swear to you. But that's why they said knowledge is key. You know what I mean?
It is.
So the more you know, the more you learn, the more you know. You know what I mean? So I really do appreciate you passing through. I thank you guys for continue supporting. This is the Ivy Cancer Podcast. This is something that we originally do on a Sunday. I mainly start this page or this podcast because I lost my mom through cancer. Yeah. So I create this podcast and I also have a YouTube page. So guys, please help me to reach 1,000 subscribers at Ivy Cancer Podcast. I plan to do great work over there. So I normally do a live every Sunday if I can get persons to do interview. And it's mainly about cancer, but I had made a question to the viewers